Hello, welcome to Portland Public Schools Risk Reduction for COVID-19. A novel coronavirus is a new coronavirus that has not been previously identified. The virus causing coronavirus disease 2019 is not the same as the coronavirus that commonly circulated among humans and caused mild illnesses like the common cold. Coronavirus disease 2019 is a respiratory illness that can spread from person to person. There are many types of human coronaviruses, including some that commonly cause mild upper respiratory tract illnesses. COVID-19 is a new disease caused by a novel or new coronavirus that has not been previously seen in humans. Symptoms may appear 2 to 14 days after exposure to the virus. Exposures being less than 6 feet for more than 15 minutes from a person who has tested positive for COVID-19. A person infected with COVID-19 may show no visible symptoms but can still unknowingly spread the disease. Look for emergency warning signs for COVID-19. If someone is showing any of these signs, seek emergency medical care. If they're having trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, bluish lips or face, call 911 or call ahead to your local emergency facility. Notify the operator that you are seeking care for someone who has or may have COVID-19. Slow the spread. As COVID-19 continues to spread across the country and the world, we all must remain vigilant. The changes we have had to make to routines and daily life are extremely hard, but these changes are even more important now and in the future. We must stop the spread of this new and dangerous virus. The more steps you and your family can take to prevent the spread of COVID-19, the safer you'll be. Cloth face masks may slow the spread of the virus and help people who unknowingly have the virus from potentially transmitting it to others. Who should not wear the mask? Children under the age of 2, anyone who has trouble breathing, and anyone unconscious, incapacitated, or otherwise unable to remove the mask without assistance. Per CDC guidelines, surgical masks and N95 respirators are discouraged because they are not critical PPE and should be reserved for healthcare workers. Face coverings are required at all times when you are in work areas, common areas, and moving through PPS buildings. This includes restrooms, elevators, and break and staff rooms. Staff members and contractors are asked to provide their own face coverings, but face coverings will be available in each building if staff members and contractors do not have one while entering the building. To reduce the potential to breathe in contaminated droplets, it is important to keep your distance from the source, other people. Maintain 6 feet of distance between you and others. Do not gather in groups. If unavoidable, never form groups larger than 25. Do not mingle or idle in hallways or other public areas. In-person meetings should be held as the last resort, and telecommunicate whenever possible. Hand washing. Avoid touching eyes, nose, or mouth with unwashed hands. Clean hands regularly with warm water and antimicrobial or plain soap. Wash hands for at least 20 seconds, or the equivalent of singing happy birthday twice. And while washing, scrub all surfaces of the hand, between the fingers, wrists, and under the nails. And make sure you dry your hands thoroughly using a paper towel. Air drying is not recommended. And use a paper towel to turn off the faucet, and use a paper towel to open the door. PPS has produced and put up new signage throughout all our buildings. There are also new protocols and guidance everyone must follow when entering the PPS site. Look for these signs throughout the building and make sure you are entering through the identified front entrance and signing in appropriately. Employees and students will be required to self-screen daily for symptoms of illness before entering district property or using district transportation. This self-screening checklist should be used to determine whether there is a risk for potential illness or exposure to COVID-19. If an employee or student has any of the following symptoms or COVID-19 exposure within the past 14 days, they should stay home and report their absence and symptoms to the school or appropriate supervisor and contact their healthcare provider. They should identify if they had a COVID-19 diagnosis, a close contact, or potential exposure within the past 14 days. Employee, student, or someone in their household has been diagnosed with COVID-19. Employee has had close contact within 6 feet of a person who has COVID-19 for at least 15 cumulative minutes in a day. Employee has been asked to isolate or quarantine at home by a medical professional or a local public health department. Again, primary symptoms of COVID-19 include a fever, temperature of 100.4 or higher, or chills, a new cough that has not been diagnosed or cleared by a healthcare provider, unexplained shortness of breath or difficulty breathing, and a new loss of taste or smell. Additional excludable symptoms of illness are vomiting and diarrhea. It is the expectation that to the greatest extent possible, all potential exposure, confirmed close contact, presumptive or confirmed cases of COVID-19 in students, staff, and contractors will be reported to PPS through the confirmed case protocol to ensure that precautionary steps can be taken to prevent the spread of the virus. Please look for Oregon OSHA's COVID-19 temporary standard for all workplace signage in your buildings. Here is further information about mitigation steps to take in your building, as well as additional resources and reporting information. For additional resources, please see the COVID-19 Employee Support website, your district building safety plan, your department-specific safety plans. Also, feel free to visit Multnomah County's COVID-19 resource page, as well as the CDC resource page. For any questions, comments, or concerns, feel free to email staysafe@pps.net. Thank you for your time.